Hi, I'm Dr. DeLay. I'm a board-certified urologist practicing in the Midlands of South Carolina, and I specialize in male sexual dysfunction and infertility. Men can hardly watch TV these days without seeing a commercial involving one of these and then wondering, do I have a normal penis? Do I have Peyronie's disease? So today we're going to talk about this disease process, how it changes the man's penis, and what the treatment options are. What is Peyronie's disease? So Peyronies disease is a non-cancerous condition which results from the buildup of scar tissue in a layer of the penis called the tunica albuginea. It interferes with most men's ability to have sexual intercourse. It is often but not always caused by some type of mild trauma during intercourse, and because mild erectile dysfunction seems to increase the chance of having this type of trauma to the penis, it becomes more common in men as they age and becomes more prevalent after the age of 50. In addition, men who have a family history of Peyronie's disease have a higher likelihood of developing this condition. If you are experiencing any of the following, you may have Peyronie's disease: pain with an erection, hard spots or lumps in the penis, bends or curves in the penis, or narrowing or shortening of the penis which develops over time. So how do you diagnose Peyronie's disease? Peyronie's disease is diagnosed with history and physical examination. Many urologists use a study called a penile Doppler to further characterize Peyronie's disease and help guide treatment. In this study, you will be given an injection of a medication to create an erection, and then an ultrasound is performed, which allows for assessment of the penile anatomy as well as blood flow. This will allow for a proper treatment plan to be designed. What are the treatment options for Peyronie's disease? There are multiple options available. We typically start with injection medications and progress to surgery, although there are a variety of options available. Oral medications are generally ineffective because they can't penetrate the plaque or the scar tissue which actually causes Peyronie's disease. There are medications, however, called Xiaflex, which can be injected directly into the plaque to break up the scar tissue. With Xiaflex penile injection therapy, the improvement is usually gradual over a 6-month period of time. While most men will see improvement in their curvature, not all men will see improvement in their penile length. This can be augmented by something called Restorex, where we use penile traction therapy to help restore some of the lost penile length. In addition to medical therapy and penile traction therapy, there are surgical options available for Peyronie's disease as well. If a man has erectile dysfunction and Peyronie's disease, he is most likely going to be best served with placement of a penile implant. A penile implant is a hydraulic implant placed in the operating room, which allows for the creation of a firm erection using the implant. The implant has the advantage of both straightening the penis and creating a firm erection at the same time. If a man has good, firm erections, curvature less than 60 degrees, and adequate penile length, he might be best served by a procedure called a penile glycation. In a penile glycation, sutures are placed on the side of the penis opposite the curve to create a straight penis. This is done in the operating room with the man under general anesthesia. An incision is made on the penis, and sutures are placed, once again, to straighten the penis by pulling it in the direction opposite of the curvature. If a man has good erections and curvature greater than 60 degrees or significant indentation or hourglass deformity, he might be best served by something called a penile incision and grafting. Here, an incision is made on the penis with the patient under general anesthesia in the operating room. An incision then is made into the layer of scar tissue, the penile plaque. And once this happens, this causes that tissue to release or open up and straighten the penis. The defect created by that incision is then covered by a collagen graft. It's really important that men have good erections if they're going to undergo this procedure, as if they don't, they likely will need further treatment for their ED down the road. No matter what the treatment for Peyronie's disease, the goal is to create a straight penis, reduce pain, and allow for firm erections. So if you think you're being affected by Peyronie's disease, find an expert in male sexual dysfunction who can treat you.